Hey everybody, welcome back. And today is my third week. Bankart lesion repair, and I had a AC joint replacement pretty much. Today's been a pretty rough day. Um, it's been pretty crazy. This is probably the worst day I've had since the nerve block wore off. I went to bed last night and got woke up at like 3 a.m. and my shoulder was just screaming. I'm not taking narcotic pain medication at this time. I didn't take any last night, and I haven't taken any all day. I'm just built different. I'd rather be in agonizing pain than take a narcotic before therapy starts, when I need it the most. So I've been taking over-the-counter stuff and just trying to stay busy. This week overall really wasn't all that bad. I'm starting to gain some mobility. I can't use it, but I have full range of my forearm and my wrist. That's good. I can smooth the camera a little bit, shall we? We can probably go about right here and probably right here. As far as going back, I can go about right here. That's pretty much it. As far as any rotation up and down, I think I can passively move it to about right here, neutral, which is pretty good. I start physical therapy on Monday, 3 weeks. My 2-week post-op appointment, the orthopedic surgeon told me to, if I'm not doing anything, that I don't really need to have the sling on. It really doesn't hurt unless it's a day like today where everything is just firing. It's hurting up here, it's hurting right here, and most of the pain that I'm having is just constantly right here within that joint. A lot of that is because of the way my shoulder was before surgery and the fact that they had to do a lot of tightening and stiffening and all of that stuff that they had to do to it. I wanted to make these videos it's not more to let people know how I'm doing, but it's kind of to let people know that of someone that goes through a similar situation, what to expect. I don't personally like talking about my personal life on my channel, but I felt like this was an instance where we could do that, to see how bad things are at the beginning, and then 5 months from now we'll see where things are. The hardest part for me is not pushing it. I'm the type of person that any type of pain, physical, emotional, anything, I've always been the type of person to just go through it, push through it, work through it, not worry about it, just keep doing something and keep grinding. That's always been my motto. You guys, people that know me personally, know that I don't stop. I'm always going, but now I have to stop and be patient and let this thing heal. So if you're feeling similar and you're a heavy grinder and you're feeling a little down about, it's normal, but you just got to remember, this is not a sprint, this is a marathon. Got to take it one day at a time. Today's a pretty rough day. It's a pretty bad day, but I'm alive, and that's what matters. I got the little dude over here this week. So being in pain and having a little guy over here kind of irritates me a little bit more than it would, but I try not to let that affect the way that I talk to him or the way that I treat him, because I know I'm in a lot of pain, so a lot of stuff I just kind of ignore where I wouldn't normally. I think it's always better to do that than to end up biting his head off, you know. So I start therapy on Monday, like I said. Um, it's a long process. 16 weeks of therapy. 16 weeks. Um, they gave me a referral for 8 weeks. I go back on the 1st of November for my my next follow-up, which will be my, what would you call that, like month and a half follow-up. And then I'll start seeing him every month, usually probably around the same time every month, until I get cleared to go back to full duty. The surgeon has to be the one to clear me. I go see my personal doctor tomorrow. They're going to look at the incisions. There's still some bruising. We're 3 weeks out, and there's still some bruising, light bruising. This is where most of the bruising was. If you guys saw the pictures from the first video I did, everything looks really good back here. You can't, here in a couple of weeks, you probably won't even be able to tell that it's there. But the incisions look really good. The holes are still healing where the staples were. It's really annoying. Sometimes I find myself just, rubbing, those holes, trying to draw the skin out and make it fall off faster. Something else I found out is that when they give you surgery, they put so much iodine from here on your entire arm. And it's such a pain because when I go shower, there's so much iodine. I mean, we're talking about 3 weeks from surgery and I'm still getting iodine off my arm. And the reason I know this iodine that's on my arm is after I shower and when I dry off after about 5 or 10 minutes, my skin will start peeling off. And it's only on this arm, nowhere else on my body. That's a reaction. That's like a chemical reaction with the iodine that's still left in my skin. And the reason it's there is because you have to remember you can't clean this area for, 2 weeks? We had to wait 2 weeks to get the staples out. So we couldn't get this area wet. So we wasn't able to, physically clean this arm or anything within that time. So we had that time just sitting there waiting. So that's why there's still so much iodine. I think we'll be getting iodine out of my arm for probably the next week and a half or so. Aside from that, there's nothing more I can tell you. I start therapy. I have therapy Monday, Wednesday, Friday. We've been binge watching some TV shows. Just don't want to move it. I did have one mix-up this past week. I was walking out of my bedroom door. I turned around to grab something, and as I grabbed it and I started walking and I didn't pay attention, and I tried to move this way, and the fact of me rotating that shoulder that way hurt, and then when I moved my body back around, this part of the shoulder hit the door frame. So I was worried about, messing anything up inside here. So I just decided to put the sling on for a couple of days when I was in the house, just to be safe on it. So that's week 3, man. It's rough. I'm not gonna lie. It's rough. It's not fun, but one of my friends got me into a new TV show that's got a bunch of episodes to watch, so keep me busy for roughly about a few weeks or so. So if you guys have any questions or anything, don't forget to leave them in the comments down below. Thank you guys for tuning in, and God bless you, and I guess we'll see you guys next week. Peace.